and what we look forward to in the next coming couple of weeks. I am joined this morning by Matt Landers, who is our county manager, and also Paul Pettit, our public health director. My name is Shelley Stein, and I serve as the chair of the Genesee County Legislature. That we are provided by the government. We know that being accessible to the vaccine is going to be another step and another tool in our toolbox to getting back our good public health. And until we achieve that recovery, our economic recovery will remain on a slow, steady burn. We understand that. Please know that we are advocating daily for an increase in dose allocation of the vaccine. And to also help our community, we are continuing on a somewhat limited basis our testing capacity that helps out our businesses and also some of our school districts that take advantage of that. We are working every angle that we know how to creatively to ensure that we are recovering our good public health. I would be remiss if I didn't say an incredible thank you to our public health department and our emergency management departments that have helped us to stand up these free testing clinics and also the vaccine clinic at the Genesee Community College. Thank you to all of our partners, to all of our volunteers who continue to show up to help with the rewarding work of helping neighbors get their good public health back. Also to those who allow our volunteers to come and to work so graciously, those that stay back and take on more responsibility and more work. We see you as well. With that, I'll end and I will hand it over to our county manager, Matt Landers. And again, thank you to the media for joining us today and sharing our message. Matt, good morning.
Good morning. Thanks, Shelley. I'm going to be short and brief here because everyone wants to hear from Paul. Paul's the guy with the answers. I just wanted to basically take a few seconds to say that this press conference is a continuation of the efforts that Shelley, Paul, and I have put forth to make sure that we continue to notify, educate, and inform the citizens of Genesee County. We are not only accessible through this medium, but through electronic, through email, through phone messages, through phone calls. And we are here to answer the questions as often as we have to. Local media have been welcome to interview us individually whenever they seem fit, and we will continue to make ourselves accessible to any media, local media, or regional media to answer the questions that they have about everything COVID related. I want to echo the sentiments of Chairman Stein about the volunteers. That has been one of the silver linings of this whole pandemic, is to see the outpouring of support from our community, both from pure volunteers that have no relation to the county to our county workers that are being reassigned. All of the county workers that are reassigned to our vaccination and our testing clinics have been 100% on a volunteer basis. And that is very heartwarming that we haven't had to purposefully reassign people. These are people that want to make a difference in their community in a different vein and different efforts. And I want to say thanks as well to the department heads that have had to juggle a lot in their departments to make sure that their work continues to get done, but it gets done in a different manner because they're losing some of their staff to help out with this very important work. We stand by ready to deliver the shots in the arms. Paul and his staff and emergency management and Tim Yeager and his staff have assembled a very efficient, lean operation that gets the job done and done well. It's just a matter of needing the doses to do the work now. So we stand ready. We have a plan in place. We have the people in place, and we're just lacking the doses, as we've been saying for weeks now. And we're no exception. This is throughout the state. So I want to say thanks again to Paul, his staff, all of his staff, Tim and Tim Yeager and Bill Shutt over at Emergency Management for helping set this up. One quick note I want to make sure is that people are continually asking what they can do to improve their chances. Well, we're all in the same boat. There really is no way to really improve it, but if they want to stay informed, I do recommend that the seniors can reach out to the Office for the Aging, and they've been a great asset to helping some of our older population to understand the process and to assist them if there is any opportunities that come up for that age group. So I definitely recommend the phone number is 813-2457, and that's for calling over at the Office for the Aging, 8 to 4, Monday through Friday, and they can get some additional questions answered, or just have someone to talk to about how to navigate this process, because it can be quite confusing. So that's enough from me. I'm going to turn this over to Paul, again, the guy with the answers, or most of the answers. And again, Paul, thanks a lot.
All right. Thank you, Matt. Not all the answers, not all the time, but we always do our best to get those answers to anybody that's asking as quick as we can. So as I get going here, again, thank you, Chairman Stein and Matt, for your opening comments. I do have my PIO, Nola Goodrich-Cressy, on the chat box here. So I'll save plenty of time for Q&A at the end, but if you guys have questions or comments on things, she'll be monitoring that. So maybe we can handle some of that, including posting links, those type of things as we go along as I'm talking. So feel free to reach out and chat as we kind of move through some of this information here. So, and again, I just want to echo, as I usually do when I start talking, the thanks that Shelley and Matt gave to our staff, to our county workforce, for our volunteers. This is truly a monumental effort, none like that a lot of us have ever seen. And, we're approaching a full year now, if you think about it. When we started seeing our first cases in kind of mid-March last year, we're quickly rolling up on that anniversary. And it's been a long year. And, we continue to enter into different phases, right, as we've gone along. And we'll talk about more of that later. But, the reality is we've had a lot of people doing a lot of good work trying to protect the health and safety of our county residents for quite a prolonged period now. And I just definitely want to recognize my staff for the long hours that they've put in over this year. As we move into vaccination now and needing bodies and vaccinators, again, the volunteers who show up and give of their own time, maybe some of the county workforce that are voluntold to come help out. But, the reality is it does put pressures on our other departments, and we need all hands on deck to get through this. So I just want to, again, thank them. I also want to just take a second to recognize our residents, our businesses, and our county folks that have struggled over this past year. I know Chairman Stein mentioned it, but we've had a lot of sacrifices, a lot of hardships. This has not been easy for anybody. Hopefully as we get more vaccines into the arms of our residents, we can start continuing to move towards more of a normalcy, right, that we used to know. And that's the goal here, to get back there. And, we just want to always recognize, the sacrifices and difficulties that everybody's been through, and we've been through it together, and we'll get out of it together. So with that, I'm just going to run through some data. I had Nola pull some information for me, kind of doing a little retrospective here, just looking back about a month and a half to see where we've gone. As we talked early mid-January, our numbers were a little bit different than they are right now. And it's quite interesting when you juxtapose and look at how they compare where we were, again, five weeks ago or so. So back on December 31st, the last day of 2020, Genesee County had 75 new cases, and we had 169 active cases. Yesterday, in our daily report that we continue to put out, providing information to the public, we had 17 cases and 67 active, so a significant decrease in numbers. For Orleans County, we had 34 cases back on the last day of the year, new active cases, and then 151 active at that time. Yesterday, we were down to 3 positive cases. So again, 34 down to 3, and we only had 39 active cases. So again, we've come quite a ways from the numbers where we are at. We continually looked at the trend lines in the region, and was not so pleasant to look at. We had many calls, many conversations. I talked to Matt many times about how Genesee particularly was highest in the region, highest in the state at one point, and we've come a long way since then. So in addition to that, just looking at the regional data, and this is for the Finger Lakes region. I know we may have some Buffalo channels on monitoring, which would be in the Western region, but for the Finger Lakes, again, doing some comparisons back on January 5th, so early this year, our average rolling new positives on the 7-day was 992 per day over a 7-day period. As of yesterday, it was down to 240. So again, a significant drop over the last, again, 5 or 6 weeks. If you looked at the positive rate, we were at 10.29 on the 7-day, down to 2.82 on the rolling average. The 14-day, 9.56, down to 2.56. When you looked at the Finger Lakes as a whole, back in early January, we were the second worst region in the state with a positivity rate of about 10.3. And currently we are down to a positivity rate of 2.3, and we're sixth in the state. So we've dropped quite a bit. Many other regions that aren't performing quite as well as we are now in the Finger Lakes. The per 100,000 rate, 82.49 per 100,000 back in January. We're down to 19.96 per 100,000. So again, continual trend. This is probably the most important one, really, when we look at hospitalizations. We talked about that quite a bit when we were looking at this in our previous conversations. As a region, we had 934 people in the hospital on January 5th, 148 in the ICU. As of yesterday, we're down to 281 in the hospital in the Finger Lakes region and 73 in the ICU. So again, just wanted to share a little bit of that data just to show where we've come over the last month and a half. Downward trend, clearly, I think articulated a holiday bump with more gatherings, more travel, but we seem to have cleared that at the moment. But I do want to articulate that even with those numbers decreasing, I can't articulate clearly enough. It's still important to continue, practicing our mitigation strategies, right? I mean, we've been talking about these for almost a year now. With limiting our gatherings, especially our non-essential ones. There still is a 50 limit in place around the state, so non-essential gatherings are capped at 50, no more than 10 still in the home setting. We need to keep wearing our face masks, keep at least 6 feet apart, and continue to wash our hands. We want to continue to see this line trend downwards, and we've been doing very well, and we want to continue to see that. So even as vaccine is starting to become more available, and we're starting to increase vaccinations in our communities, we still need to adhere to those mitigation strategies in order to keep the numbers low. All right, so a few things on business restrictions, reopenings, lifting of restrictions. And again, there's been some more in the news on this recently, so I'm not going to spend a lot of time on it. But just in general, we are seeing loosening of the restrictions starting to occur more and more. And that was something that we were hoping to see, and obviously that's starting to happen. And with the rates going down around the region and the state, I think it makes sense that that's starting to occur a little bit more. But obviously it needs to be done methodically. It needs to be done while monitoring and looking at the data and keeping track of local cases and our vaccination efforts. All that data kind of goes into a big pool and helps us inform as much as we can locally on our decision making. But obviously the state uses that as a trigger for how they determine on different restrictions and guidelines. But the governor seems to be moving towards a lot of different venues and activities starting to potentially open back up over the next few months and heading into the summer. Testing seems to be something that he's going to rely heavily upon to participate and to attend and be a part of these different venues and events. We know that as far as weddings are concerned, starting March 15th, he's allowing them to have participation up to 150 people or 50% of the capacity of the venue. And again, there is a testing component to that where folks would have to have a negative test in order to be able to attend. We do not have any additional guidance on that yet, although it was announced a couple of weeks ago as far as the whole testing piece of when and how that's supposed to occur, who's tracking that, etc. We have not gotten that information yet, so once we do, we'll be sure to get that out to the public and make sure our venues, etc., know what the requirements are in order to increase capacity in those type of settings. We do get a lot of questions. What about retirement parties? What about birthday parties? Why only weddings starting March 15th? I don't have the answer on that. So the reality reality is, I think logically it would make sense that any of those venues would, potentially be under the same type of oversight and same type of gathering limits. But at the moment, again, the state releases and has control over, how they expand these different type of events. So at the moment, it's only in regards to weddings, but I would like to think that we'll see some additional type of activities included at some point here in the near future. Also, bars and restaurants, obviously their ability to stay open was expanded another hour from 10 o'clock to 11 o'clock. So that took effect this past Monday. So again, some additional capacity being allowed from the state there. Again, yesterday the governor did announce, obviously more venues at limited capacity starting to open up. Different, I know children's camps, he talked about those, overnight camps this summer being allowed to open again at reduced capacity. So again, there'll be more information coming out in the guidance on that. Again, we, through the health department, regulate those type of facilities, so we'll be working with them directly when we get the guidance. Also, amusement parks and different types of entertainment centers are also going to be eligible to start opening back up at reduced capacities. So again, there's a lot more information that will be coming out on those. Again, we can't do much until we get the guidance. This is again pretty typical of what we've seen throughout this pandemic. We get announcements live, and then the guidance comes 3, 4, or 5 days, a week later. So again, we need a little patience there till we get the information, so we can clearly articulate what that means for everybody else in the community moving forward. So hopefully we'll get that guidance here in the next few days and upcoming weeks. I also would encourage anybody to continue to monitor Forward New York, especially businesses looking at restrictions and changing guidance. We haven't talked about Forward New York quite as much, but that website is still there. It still has all of the current guidance for different businesses, gathering sizes, limitations, etc., that folks have to follow. So continue to monitor that, and I do believe as the state changes things, that will be updated to reflect the current guidance. So we would encourage folks to continue to monitor that website moving forward. Shelley mentioned a little bit on testing. So again, as far as the county testing clinic, we do have one scheduled for next Tuesday over at the Emergency Management Office. So again, normal procedure for signing up, go to the website, and that sign-up process is what we've been using since late November. We are kind of moving to a week-by-week process here, though, where you're obviously limited by, testing supplies, but also staffing, right? As we continue to start shifting efforts towards vaccinations, we only have so many staff and volunteers to go around. So, we're starting to push more towards that, but as we kind of balance the lack of vaccine at the moment and still the capacity, we still plan to offer testing as available. So it'll be more of a week-by-week approach, but we'll make sure we get the signups up there. And the plan would be to continue to test on Tuesdays as long as we're able to. There's still obviously testing still available in the community at more traditional locations. So we'd encourage folks, if they need testing, to continue to seek that out as best they can. But as far as the county monitored ones, again, those are becoming a little more scarce as our focus shifts to vaccinations from testing. All right, so I want to spend a good chunk of time here talking about vaccinations, because I know we get a lot of questions on that, and there's a lot of concerns in the community. And Shelley's absolutely correct. We understand that it's very challenging. We have folks that are upset, that are frustrated. We would echo those sentiments. We're upset and frustrated also. We spend a lot of times on phone calls talking about, I said it's good therapy, so we can talk amongst ourselves anyways to complain and try to figure out what's going on. So we share your pain in that aspect. And we are doing our best locally to get this vaccine out as quickly as we can. The challenges continue. We continue to hear about increasing allocations from the state. And we've been hearing that for weeks, coming from the feds to the state. But that has not translated into increased local allocations for specifically rural counties. And as you look at week by week, we're in currently week 10 right now. But just for an example, going backwards 3 weeks, week 8, Genesee County as a whole, so this is all providers, locations in Genesee County, we received 600 doses. Week 9, 500 doses. Week 10, 500 doses. Orleans County, week 8, 500 doses. Week 9, 200 doses. Week 10, 500 doses. So you can see that they have remained flat. So we have not seen any increases to our clinics, whether they're county run, through the providers, through the pharmacies. So, although it appears there's more vaccine out there. It's not in our counties. We have seen increases in the state-run sites. So that's the Dome Marina over in Monroe County and University of Buffalo over in Erie County. But again, those sites are booked up well through into April, we're hearing now. So, the key message we've been talking about is eligibility does not mean availability. That has not changed, right? Even though our eligible group expanded significantly this past Monday, we, as I just went over those numbers, have not received a lot of additional vaccine at all to start to handle that increase in numbers. Some things to note: vaccine is coming into the county through several different buckets right now. So there's vaccine coming from the state, right? That's going to local health departments, to providers, to pharmacies. There's also vaccine coming in, starting right to the pharmacies from the feds. There's also a word, obviously the governor announced that there's going to be some new federal clinics being stood up in Monroe County and Erie County and other places around the state that'll be funneled directly from the feds. Again, unfortunately, none of those are earmarked towards the rural counties. Again, those are going into the urban areas. So there's a lot of different ways vaccine is coming. It's just so I know it's very challenging and hard for folks to keep track of. The other challenging piece, just so we're clear with everyone, is we're limited by the state on who can vaccinate who, which again makes it very challenging. The state has restrictions on who the local health department can vaccinate. Most of the vaccine coming to us is allocated directly towards essential workers based on the 1A and 1B groups. We are not allowed to target 65 and older. Pharmacies are only able to do 65 and older. They can't do essential workers. Obviously with the comorbidity, those with underlying health conditions, that group opening up this past Monday. Obviously, there's a lot more folks that are looking for it. If we do get special allocations to the local health department, we are able to target that group, and obviously providers are coming on board, and they'll be vaccinating their patients potentially as they start to get vaccine. But I guess what I'm trying to articulate, it's clear as mud. There's a lot of moving parts, a lot of different restrictions, and we're doing our best to try to decipher that and get that information out to everybody as best we can. So again, that's going to continue to change as vaccine continues to come in from different directions. We still don't have good eyes on how much vaccine is coming in from the feds to the pharmacies or the feds to the FQHCs when that starts. So we're doing our best to, again, collate that, and we'll be sure to share that as we get that information to make sure you guys possible. So the other challenging piece is with all the vaccine coming to different places is you have to look at different places to find the appointments, right? So if you go to the state site, that's for the state sites. So if you go on New York, the website to sign up, you're looking at signing up for the Dome Marina or UB. You can't see our local clinics on that. If you're signing up at the pharmacies, every pharmacy seems to have their own hub and system for signing up. So you have to go to CVS, to Walgreens, to Rite Aid to keep looking for available slots. If you're coming to one of the county clinics, you have to obviously go on the county website and look through that means. So again, fairly complex, frustrating. We encourage patience, keep a lot of browsers open on your website, on your computer, so that you can click back and forth and keep refreshing. That's the best advice at the moment we can give is you got to keep looking. And as hopefully allocations increase and we have more availability, it will be easier and easier to find appointments. The other question we've gotten a lot is recently is around homebound folks that have challenges getting out and going to their provider or these public clinics. At the moment, we're currently asking those folks to work with their primary care provider or their caregivers on getting on a list. We don't currently have the capacity, obviously, or the vaccine to start going around and doing that level of group of folks. So we're currently trying to build that list. So we'd encourage you to make sure you're in contact with your primary care provider so that we know who you are, we know where they are. I've talked to many of them already in our communities, and the providers have a pretty good idea of who their folks are that are more traditionally homebound or have issues getting out to the bigger public clinics. So you are not forgotten. We know you're out there, and we are working on a plan to make sure that you'll have access to that vaccine as soon as we can get it to you. All right, so a little bit on numbers here too for vaccine distribution. We just actually got these hot off the press yesterday. So Genesee County so far, as of yesterday, there were 6,060 folks in Genesee County residents have received their first dose. So again, 6,060. In Orleans County, that number is 3,052, and this is first dose only. Again, several of those have also received a second dose, but first doses, those are the numbers as of yesterday. We have ability now to have better eyes on that through NICIS, the state reporting system for vaccines. So we'll be starting to include some more demographic data and total numbers, including zip code or kind of east-west central in both counties in our daily reports moving forward. But it is nice to start to see a little bit of a profile of where we are with vaccines given. Just for a little reference on that, so again, Genesee County has roughly, and these are approximate, about 46,000 or so that are over 18. So if you look at the amount of people that are vaccinated, that's about 11% of our population that's eligible currently. Well, I guess not even eligible currently. That's over 18. Again, there's still a portion that's not eligible due to, if they don't have an underlying health condition. So we're at about 11% of the adults, I guess, for Genesee County that have been vaccinated. In Orleans County, that number is about 33,000 over 18, so we're at about 7.5%. So again, just trying to give a little bit of idea of the numbers of where we are per population of vaccination. So we have a ways to go, but we are, starting to get there. Again, up over 11% in Genesee and about 7.5% for Orleans. So again, we are vaccinating as when the vaccine comes. We're getting it out the door as quick as we can. Just a reminder, our county clinics in Genesee County is over at GCC, the main campus. We're using the athletic complex, and in Orleans County, it's at the Ridgeway Fire Hall up on Route 104 in Ridgeway. So we do have a large capacity and ability to push a lot of people through those sites. During a 7-8 hour shift, we can easily push through over 1,000 people at GCC and over 700 people at Ridgeway. So again, if we had the vaccine, we could meet the demands and put large numbers through, similar to what you're seeing out of the bigger venues in the cities. All right, the last thing I want to talk about real quick is, we are going to be requesting a regional site. So the governor had been talking about increasing additional regional capacity of mass vaccination sites. As I mentioned, obviously there's one in Monroe County, one in Erie. We'd like to see one in Genesee at GCC. So we're currently seeking the governor to place one there. We believe it's a potentially great venue. We could push easily a couple thousand people through there if we were able to fully expand and per day. So if the state can provide the vaccine, we can put together the venue. If it's a collaborative between Genesee, Orleans, and Wyoming, I mean, that's about 140,000 people, plus pulling people on the west and east sides of Erie County and Monroe and Livingston. We believe it would be a great location that the state could set up shop and provide a lot of vaccines to the people in our general catchment area. So we are, going to seek the governor to consider placing one there, which again should open up significant access to our folks. So with that, I do want to leave some time for Q&A, I guess as we open that up, I'd like just make sure you state your name and affiliation, what news network you're with, and again, we'll do our best to answer any questions you have. If we don't have the answers, we'll be sure to get them back to you. But with that, I will turn it back to Matt, I guess, to moderate questions.
Great, thanks, Paul. So if you want to come off mute, feel free to ask questions. We'll try to do this in an orderly way. Or Paul.
Hey there, Paul. Jeff Cavall with Channel 2 out here in Buffalo. Could you maybe just elaborate a little bit more about the issues that you're having with vaccine administration, people able to get doses, other than just what you were saying about the lack of not having enough vaccine? Is there anything a little bit more specific that you can be on in terms of the issues you're seeing?
Well, I mean, so as you look at the different buckets, you got the 1A, the 1As and the 1Bs, right? Those essential workers, and then you have, obviously, those over 65 have kind of been parsed out into their own bucket, and then now with the comorbidities, basically 18 plus, right? So, which kind of overlaps with the 65 and older. Again, I think the challenge that we're really seeing is the restrictions placed upon different providers and who they can vaccinate. So when we're basically being told, excuse me, you can only use the vaccine for certain groups, it restricts your ability, to get that out effectively. As we've seen with COVID over the last year, those that are disproportionately affected negatively are seniors, right, 65 and older. Those are the ones that unfortunately end up in the hospital more often, end up in the ICU, and in most cases of our deaths are in our senior population. We would like more autonomy and ability locally to make determinations on where and who we can vaccinate, and if we could focus our vaccines on our most vulnerable populations, we believe that we can prevent death more readily, right? And people utilizing our hospital beds. So the challenge is obviously we need the vaccine, right? If we had enough vaccine, we wouldn't have as many of these problems. But even when you drill down a little bit, who and how the vaccine can go out to certain groups is limiting. And unfortunately, we have large groups of seniors that are on waiting lists at our Office for the Aging, as Matt mentioned, that are waiting to get this vaccine, and we can't give it to them, yet we're vaccinating presumably healthier younger adults, as essential workers. So again, there's an interesting dynamic there where just based on who we're allowed to vaccinate, we're unfortunately not able to potentially get it to our most vulnerable. So again, hopefully some loosening of those restrictions and ability to just vaccinate people and let us have some more autonomy in who, hopefully that could potentially lead towards hitting some of these higher risk target groups moving forward.
Have you heard anything about hospitals having their doses reallocated to other areas? That's something that the governor had mentioned, that if hospitals, basically, don't use them, you get a bunch of, doses being left over, that they could be reallocated. Is that something that you're seeing out there in the Finger Lakes?
I guess it's hard to say it's seeing that happen yet, right? So we do know that UMMC and Orleans Community Health both received an allocation this week, respectively. So, again, they're still getting some vaccine. The governor did talk about shifting the vaccines away from the hospitals and more towards the county health departments to work on the comorbidity groups. And again, that would be working with our community partners, our healthcare providers, and those type of groups, again, trying to hit the comorbidity buckets, right? But at the moment, based on what we've seen, there still seems to be some vaccine going to the hospitals. There still are some 1A groups left, healthcare workers that are now, maybe didn't want to get vaccinated, when it first came available to them. Now they've seen it for a while and they're interested in getting vaccinated now. So there are still some buckets out there that haven't been fully filled. But ultimately, it from our expectation of what the governor said, that yes, vaccination would be shifting away from the health systems, unless again they have their private practices, right, which one they would be vaccinating their patients. But again, we do expect to see more coming to the local health departments, again, to either use ourselves or redistribute within our community, again, to meet those groups with underlying health conditions.
What about federally qualified community health centers? Mm-hmm. That's something that is new as well. Are you seeing any out there getting vaccine?
Yeah, so I can speak again locally. So Oak Orchard Community Health is our local FQHC in both Genesee and Orleans County. And so they did receive an allocation in both counties this week of 100 doses to start, again, vaccinating their patients. But they had received zero vaccine for like 5 straight weeks. So they were very involved in the front end, vaccinating the 1A groups, their healthcare providers, but within their network, and also, first responders, OPWDD groups. But they went for a stretch without receiving any vaccine. But again, they did get some this week. And again, with the federal program, it does sound like at some point in the near future, they will start receiving vaccine directly from the federal government to start working on their populations. And again, the FQHCs, particularly here in Orleans County, is one of the major healthcare providers. They have a lot of high patient load. In addition, they've just recently expanded into Genesee County. So we do expect them to be a significant partner in getting vaccine out, whether it's from the state allocations or directly from the feds.
Another question that I have, just wondering whether you're seeing any of this happening in the Finger Lakes. Erie County's executive posted on Facebook that they're seeing a number of people making numerous appointments to get vaccine. with the county and then with other health providers. Is that something that you may have seen at all, amid the pandemic or the rollout of the vaccine, in terms of people going from maybe a CVS to the county to somewhere else to kind of scoop up all these appointments? Is that something that you have seen at all?
Yeah, so we have, and that is a challenge, and we've talked about that a bit in our daily press briefing brief that we put out. Yeah, we want to discourage folks from kind of vaccine shopping, I guess might be a good term for it. Trying to sign up for multiple appointments. If you are lucky enough and you get through and you have a spot, we would encourage you to stick to that spot. What we see a lot of times is maybe they get one for 3 or 4 weeks down the road, and they just happen to get lucky and find one for next week. The reality is when you take up multiple spots, you're now a placeholder, right, for all these different clinics. So you're showing up for us as a spot, you're showing up for a pharmacy, for the provider, and unfortunately it reduces the available slots for other people. If you do happen to have multiple spots taken, we'd encourage you to pick one and go on and cancel the other ones, right? So what happens, at least on our end, when someone cancels their appointment in CDMS, which is the system we use, it'll actually open back up. So the public clicking on our site would then see, oh, an appointment just opened up, okay, so I can sign up for it. If they continue to hold them or they don't ever cancel them, we end up having at our clinic someone not show up, and then we're scrambling at the end trying to find someone on standby to come in at the last minute to receive that vaccine. So that is an issue. We'd encourage folks not to do that. And if you do have appointments set, make sure you cancel them all officially, except for one, so we can make sure we have as many available appointments out there for everybody else.
And how are you detecting that issue? Is that something that you're just hearing from the person themselves? Oh, I set up 3 other appointments, or is that something that you're cross-checking with your systems or databases, or reporting from other health providers?
Yeah, unfortunately, as I kind of went through the scattered way things are coming in and the different buckets and how people register, there is not one way to currently view all that, right? So we don't have eyes on the pharmacy's list of who signed up. We don't see on the state's list of who signed up. So we only know locally at our county site. So again, if you're signed up at a pharmacy, multiple pharmacies potentially, one of the state-sponsored mass vaccination sites and the county site, we can't see that, right? So we can only see our bucket at the moment on that. So again, it's really more incumbent upon the individual to make sure they're not doing that, and if they are, once they have the spot they want, make sure you officially cancel all the other ones so those slots open back up for others.
And this sort of appointment, vaccine shopping, this hasn't resulted in any doses being wasted?
No, we're very careful not to waste any doses. We don't want any vaccine not getting used. So again, we do have standby lists, where people don't have an appointment, but we're looking for someone at the end because of a no-show or something like that, where we're able to get them in at the end. These are eligible folks that are currently under one of the eligible groups. So we will not waste vaccine.
Hey, Paul, it's Howard Owens from the Batavian. How you doing?
Good. How are you?
Good. So, just prevalence right now. What do you attribute maybe to the drop in numbers that we've seen in the last few weeks?
Yeah, so as I mentioned, obviously I think we're past that holiday bump. We kind of expected to see that through most of January, which we did, right? Our numbers have really started to come down significantly in February. So I think that's one of the bigger drivers. We had a lot of folks, gathering, getting together over the holidays, a lot of travel. So I think you're seeing some of that come into play, and obviously it's been very cold as of late in Western New York. So you don't have as much commingling and gathering just in general, with still the restrictions in place. I think that the numbers are a little more reflective of, behavior at the moment. So again, encouraging folks to continue to try to minimize those contacts, keep your masks on, keep hand washing, so we can keep those numbers down.
The spread that we do have, the prevalence that we do have, any idea what the contract tracing is showing as kind of what the most risky behaviors are that people might be engaging in?
I'm not necessarily anything specific. The numbers again coming in even in the single digits now. We're not tying anything to major clusters. We are seeing, once in a while, again, a gathering, maybe a birthday party or some type of an event, where they got together for, Super Bowl, those type of things that, may have added to a few little small clusters of people. But in general, again, we haven't seen any significant venues or activities that have led to bigger outbreaks at the moment.
And that answer probably ties in my next question, but we're probably more than a week now into winter sports being played at the high schools, and it looks like there's been no issues with sports starting up again.
Yeah, so we did a lot of work with our schools. Obviously, there was a lot of discussions a couple weeks ago around this as the governor okayed high-risk sports to resume. We've had great compliance and a good collaboration with our schools, as you guys are well aware, throughout this pandemic. And everybody seems to be doing their part and trying to do their best to keep masks on the kids when they're not in play, unless they can't medically or tolerate it. So overall, things have been going fairly well. We do have our contact tracers working with schools if we start to see any cases amongst the athletes, and then obviously that would result in quarantines and potentially that team being sidelined for up to that 10-day period. But ultimately, we're doing quite well overall, and we're hoping that we can continue to see that success moving forward.
Finally, we're seeing, I've seen a couple of news reports where epidemiologists say, we're not out of this yet, long winter ahead, these new variants. The next 3 months could be some of the worst times of the pandemic. Is that a concern you share? Just kind of what are your thoughts and what are your recommendations for people?
Yeah, so I don't think they're wrong in their assessment. There's always a concern with a virus, a novel virus like this, especially as you mentioned, these new variants that are out there. We have not identified that locally in Genesee or Orleans County yet, any of the big three, I guess, that they're monitoring, the UK, the South African, and the Brazilian strains. But we do know they're a little more infectious, right? And that there's a highly likelihood if we start seeing those strains that they can be spread around quicker. So we're kind of in this balance, this dance of vaccination and trying to keep our numbers down, right? The more people we get vaccinated, presumably we can raise that herd immunity. We can hopefully minimize severity of impact if people get COVID once they get vaccinated. But as the rollout still remains slow, and we still have long ways to go, it's again really important that people still continue on these mitigation strategies that I've talked about a couple times already. Trying to minimize those gatherings, stay apart if you don't have to get together, keep your masks on, socially distance as best you can. Because as we move through the next few months, that's kind of hopefully we get to that tipping point where we have a kind of a larger number vaccinated, and we can hopefully start moving on to again a little more normalcy as we move forward beyond that.
Great, thanks, Paul.
Yep.
Hey, Paul, just going back to one of your previous comments, you were referring to the modest increase in doses, and that really hasn't translated in rural counties. Why do you think that is, and do you think that politics might be at play here?
Well, again, we don't have the insight. We're basically given, the allocations that the state decides to divvy up. We do know that, the state believes mass vaccination sites are a better way to push volume. And I guess I wouldn't disagree with that. It gets a little more challenging when you start sparsing out, 100 doses here and 100 doses there. So if you look at the state sites, again, the Dome Arena, GCC, they're pushing hundreds or thousands through there. So they're getting fed vaccine. I guess the biggest thing we just want to know is, and we'd like to see, is that vaccine starting to come into the rural areas a little more readily and a little more parity with where that vaccine's going. We do have transportation issues. We have folks that have other challenges that, we need more vaccine in our local communities. I mean, we understand the population divide and making sure allocations are based appropriately based on population. But ultimately, we need increases in our local communities, and not just Genesee, Orleans, but all the rural counties in order to meet the needs. So, Again, I'm not going to comment on the political side of that, but the reality is, we're doing our best to advocate, and we need to, hopefully see better balance in the allocations, and so that we can get that vaccine out in our local communities.
Hey, Paul, Emily Putnam here from News 10 NBC in Rochester. Thanks for taking the time to talk with us today.
Sure thing.
We know that Leroy School District has plans to go back to in-person learning in the next couple of months full-time. Are there any other school districts in Genesee County or Orleans County that have plans to go back full-time in person?
So I don't have the full list right in front of me. I know there's been some conversations around that with a couple other schools, and again, we've been talking with them pretty closely, making sure that they're still following the guidelines that are out there. Obviously, there's been a strong desire all along for schools to get more, get back to more in-person learning full time. We've done very well in Genesee and Orleans County since the beginning of the school year. Our data has clearly shown that we have not seen a lot of transmission in the school settings. It's way, way below, obviously, with the numbers that we saw on the community side. So we're very supportive of trying to increase in-person instruction, as long, again, as it's being done as safely as we can, including masks and, keeping that distancing in place as best we can. But ultimately, I think we're going to see more and more schools try to move that direction. And, again, we need to follow the data and look at the numbers. But ultimately, a lot of these schools are doing a great job, and they are putting together solid plans that, again, meet the intent of the guidelines, and hopefully getting these kids back in school, back to more in-person learning.
All right. Last chance. All right, Paul, nice job. Yeah, you answered a lot of the questions ahead of time, I believe, and you answered the questions well that came up. I want to thank everyone for joining us, helping us deliver the message to not only Genesee County residents, but to anyone in the area, in your viewing areas. We value the relationship that we have with our media, and again, we have made ourselves available, and we'll continue to make ourselves available as much as possible to help deliver the same message, a consistent message out to our residents. Chairwoman Stein, do you have any parting comments?
I think we just need to be mindful that even if folks are vaccinated and have received their second dose, it doesn't mean that we can relax with our masking. So we still need to ensure that we are taking all of the necessary precautions so that we can get back to some sort of normalcy that we remembered a year ago. Thank you. Thank you all.